Hi, I'm Karina Bennett, and I am here in Des Moines, Iowa, with the founders of Healthy Birth Day, a nonprofit dedicated to preventing stillbirth and infant death through education, advocacy, and parent support. Hi.
Hello.
Hello. So can we talk about how this organization was founded?
You know what, we tried real hard not to start the organization. I think that's actually, we've been working together for, 9 years? Mm-hmm. 9 years, and we always wanted to do our work without starting an organization because we felt like we'd get overwhelmed with the administrative side of starting an organization.
And what's the work?
The work in terms of stillbirth?
I just mean like you wanted to do work on preventing stillbirth, and that was the work that you were focused on?
Right. We all met shortly after each of our experiences, and really just started meeting as friends and as moms in coffee shops.
It's more of support. We met just to support each other.
Yeah, yeah. And the more and more we met and talked, we were appalled that no one was talking about stillbirth, and nobody was trying to do anything about it. Our doctors were telling us that what happened to us was very rare, and that it just never happens, and you were one of those rare circumstances. And it didn't seem so rare when every month or every 2 months someone was added to our group. Our group started out with me, and then it was, well, actually no, the group started with Kate coming to my hospital room, yeah.
Oh, really?
And then I met Janet, and then pretty soon I got a phone call about Jan. So we met Jan, and then we got a phone call and found out about Kerry, and this all happened within months of each other. Uh-huh. And we were all told it was very rare and it doesn't happen. Right. So.
And then you all got together since you lost children, and eventually you felt compelled to actually make an organization, a nonprofit. What made you choose to do that?
We had had a lot of success, just kind of our coffee shop conversations, coming up with ideas of things that we wanted to start here in Iowa. And I think it wasn't until one point where we had a company in Des Moines that wanted to help us through their foundation and asked for our 501c3 status. And when we told them that, we're just a volunteer group of moms that are working on stillbirth prevention, they said, we'd love to help you, but we can only help organizations who are nonprofits. And I think that's when we stepped back and said, we're going to miss opportunities if we don't just fill out the paperwork and make ourselves official.
Okay. What is Count the Kicks? Can we talk about the campaign that's a primary campaign for Healthy Birth Day?
Count the Kicks is our main focus as our organization, and it started with some information that Janet and I had learned about in Washington, D.C., and I'll let Janet tell you about that because she can script it.
We were at a conference presenting on our stillbirth registry in Iowa, and while we were there, we found out that there were also researchers there from Norway who had educated expectant parents on the importance of tracking their baby's movement daily during the last trimester, and they also educated their providers too on what to do. And the success of their study, Kerry would probably do a better job of explaining it, but they reduced their stillbirth rate by 1/3.
And you were saying earlier you were coming home on the plane and you're like, let's do it. Let's do it in Iowa. Like if you can count the kicks in Norway, you can count the kicks, in Iowa enough, right?
Well, I think our conversation was, they're going to do this in Norway, and the study isn't published yet, but Janet and I were like, we can't wait. And we initially talked about how do we do this for the United States, and we're a group of moms. We can't tackle the whole country, and it's going to take money and a lot of resources. And Janet said, you know what, we did amazing things with the stillbirth legislation in Iowa, and let's just start with Iowa and let's get it perfected in Iowa.
So we can't do the country, but why not the state?
Right. But we're going to do the country, so.
But you're going to do the country.
We are.
What would be your main goal for expectant parents to know from from your own experience and the campaign that you've put out there? Is there kind of a core, like, hey, if there's one thing I could give you, like go to your doctor or listen to your body, or like what would you say?
I think just from the feedback that we've gotten from some success stories through Count the Kicks, moms that have emailed us or called us and said, I did this and you saved my baby's life. But it's really getting to know the personality of your baby and the trends of your baby's movement. And that's what has, moms that have followed Count the Kicks, that's what has prompted them to contact their providers or go into the hospital with, you know, I've been doing Count the Kicks and my baby is always very active at night, or my baby's always very active at a certain time. And I started noticing that the activity was slowing down, and then the next day it slowed down even more. And so all of the success stories that we've had thus far, they've come in with, I noticed a difference in the movement. And then I waited a little bit and I noticed it again, or it got even slower. So I would say, you know, the biggest thing to tell parents is just to pay attention to that movement, and using the kick track cards that we have, which you can get online or order through Count the Kicks, and tracking it so that it's hard to remember, you know, exactly when your baby's, but when you're tracking it every day, you start to realize, oh yeah, this baby moves a lot when I go to bed, or when I sit in the car, when you sit and calm down, yep, this baby always moves.
So let's talk about a success story. It works, right? You've had, you know, people contact you with stories. I think even this week there was a new success story, right?
Right, Kerry could probably.
Yeah.
I received an email from a former coworker of mine. She was actually the preschool teacher for my children, and her son and daughter-in-law were expecting their little girl in a couple of weeks, and she had always advocated Count the Kicks for them to do, and Emily did them faithfully every morning, and on Sunday morning she noticed there was a significant change. They went to the hospital, and the baby was in distress after they had monitored her for a while, and they moved to a C-section, and little Lily's cord was wrapped around her neck twice.
Wow.
And she's healthy and fine now.
She's healthy and fine. That's great. What I love about it is, like, it's really hard to argue against, because it really can't hurt. It's free. Like, it doesn't cost any money. So you're pregnant,
non-invasive.
you're listening to your baby. Like, that's all you have to do. It's non-invasive, like you're saying. And, you know, where's the downside?
Yeah, it doesn't require insurance. It doesn't require
Right.
medical equipment.
It's easy to teach.
It's easy to teach. It's just
a
like,
great way to bond with your baby and get to know their little personality before they come. Dads can do
Right.
it, grandparents, siblings.
I think actually it's the simplicity that's confusing. I know that might sound really stupid, but it's kind of like, people are like, okay, so here's this really serious issue that nobody wants to talk about.
Yeah.
Let's not talk about babies dying. We're just not going to do it. And here's this really simple thing you want me to do, and you think it's going to help. Like, I think in some ways people are like, and
Right.
what else? You're just like, Count the Kicks, and what? Is there like a needle? Is there a test? But it's like, no, really, you can actually, if you consistently monitor the baby's movement, that actually does something.
But I do think providers do need to help parents make the connection of why is it important. And I know a lot of times it seems like providers don't want to touch on stillbirth because pregnancy should be a happy thing and you don't want to worry the
Right.
moms. But as a mom who's lost a baby, I would have much rather been more worried during my final trimester than to be a grieving parent.
Yeah.
And
I'd much rather be stressed out than bury my baby.
exactly.
Yeah.
Yeah, and I think that our society focuses too much attention on the first. I mean, they worry about the first trimester on issues that are, a lot of those are out of a expectant parent's control. But
Right.
the last trimester, the issues that we should be worrying about are not addressed like they should be in a lot
Right.
of clinics.
This isn't something we've, made up. So it's a standard of care that doctors know about. It's just not always promoted. So we hope that Count the Kicks can help physicians do that, and at the same time have moms and dads aware outside of the physician's office that it's something that they can do. So to make that easy, free, accessible. We tried really hard to not make our materials scary. That's always a concern. Sometimes we hear from physicians, I don't want to scare my patients, but you don't tell a woman not to do a breast exam because she might be scared, right?
We don't want to scare you. We won't test you for breast
Right.
cancer. We just won't test you for breast cancer because we don't want to scare you. But sorry if you die. It's okay. Yeah, that
Give
doesn't
us more
really
credit
work.
than that,
Yeah.
so.
A little more credit than that. Now, did any of you know about the possibility of stillbirth, or did your doctors talk to you about that before it happened to you?
I had heard of stillbirth before, but I didn't even know it happened anymore. I thought it was something that happened to our great-grandmothers, and we've all talked about that.
I was shocked when I found out 1 in 160 pregnancies ends in stillbirth. When you see the numbers, you're just astonished that it's still
is
going on and
amazing,
it's still
isn't
that
it?
prevalent.
Yeah.
And that it's such an ignored pregnancy complication that women wouldn't be advised about risks or prevention methods.
We have 4D ultrasound now, you know. How could a baby die, you know, to a cord being wrapped around its neck when you've got 4D ultrasound?
And then for yourselves, I mean, how has losing a child changed you? I know I've spoken to almost all of you personally about this, so I know it's. I mean, and I also have lost a child. You know, I had a stillbirth myself, and I know personally that it's just a horrible experience. But how is it? You know, how has it changed you as a person? And I'm sure that's the reason why we're all sitting here. Certainly, is because we lost a child. I know there's no way there would probably be this wonderful organization if it wasn't for the children we lost. Carrie. Come on.
I always say that Grace has made me a better person, and that even though she did not live to take her first breath, that she taught me so many lessons about life. And they haven't been easy, but they've been very transforming. And there's a different definition of what a bad day is and what stress is, and true friends, and trying to live your life to make those angels proud.
And this is how you're Grace's mommy. I love that line, right?
You get to be Grace's mommy.
When I do this work.
Yeah. It's nice to think of making our children proud. I think of that. Even coming here, I live in New York City. I'm very like buzzing on the plane. I was just nervous even about getting here, like as if, you know, oh.
It's great. These women are just wonderful. I'm a better person. It's just, I feel honored to be your mom.
Yeah.
My daughter Jaden. It's a good thing.
Yeah, it's a good thing. It's hard to be without them though. It's really hard that, you know, they're not here, but I think it's good to try to do work to help other people not have to suffer the same loss. And I think that's why it's important to sit down and try to communicate to other parents, like, listen, you should listen to us because we know something that hopefully, you know, our knowledge will help you never have to go through what we went through. Because there's just too many mistakes in life to make, you know, like there's just too many mistakes. Like, you know, not everybody should be a heroin addict. You should probably just learn, you should probably learn to, you know, you can show your kids, like, you see that bum on the street? Don't do that. And I mean, this is different because here you are, all beautiful women who are good moms, and a lot of you, you know, you're working and vibrant in your community, and like most people would look at you and have no idea that you lost a child and just assume like everything's, you know, hunky-dory, you know, but that's just a credit to your strength and grace that you can be here and be excelling, but carry this pain. What does it feel like when you hear, I mean, you just got this story this week, a new success story, and you've had a number of them. What does it feel like when you hear that you've actually helped save a life?
I mean, it's pretty fantastic. Because I think the one thing we've all agreed on is that we just don't want other families to be in our shoes to join our club of, you know, I mean, anytime we could prevent another family from going through what our families have gone through is just such a great feeling.
It's a strange thing, as in, you know, when we were going through it, we wanted so badly to see someone else who'd lived through it. At the same time, we don't want anyone else to have to live through it.
Right.
Yeah, and that's when I met Kate, I thought, oh, you know, you hate that someone else's experiences, but at the same time, it is comforting to know that there's people that have the same questions and that kind of thing. When we started all of this, we said if we could just save one baby, it would be worth it.
Well, it's worth it. It's worth it. You're doing good work. You're like, I'm not hugging you. I'm going to give you a high five. High five.
But we've saved a lot more than one baby.
That's right. You saved a lot more than one baby.
Stillbirths can be prevented with your help. Visit www.counttthekicks.org to help save lives.